Hi, my name is Christopher Walton. I am a licensed clinical social worker and I am a professional speaker. And I talk to people about my book, which is titled Navigating Your Mind, Achieving a Life of Peace, Joy, and Happiness. And today you are on our podcast for East Idaho Therapy. And we have our clinicians, well, one clinician, Al, and myself, and a couple of support staff who are helping out. And we appreciate you being here.
Mhm. Hi, my name is Caroline Azzo, and I am one of your co-hosts.
And my name is Sly, and I am also a co-host.
Welcome to the Navigating Your Mind podcast, where we explore the fascinating world of mental health and all of its implications for our daily lives. Each episode will conduct interviews involving experts, interesting case studies, and have lively conversations about the effects of living in our changing world and its impact on us. We'll be your guide as we navigate this ever-evolving landscape and discover how a healthy mentality can change our relationships for the better. So join us and let's start learning. Today, we will be talking with Elizabeth, who is a licensed master social worker, licensed in Idaho, Texas, and Arizona, and working towards her independent clinical licensure. She also holds a certificate in trauma and bereavement from Arizona State University, and she is EMDR trained. She currently lives on the Gulf Coast in Texas, but loves to travel, so she's grateful to be able to provide teletherapy online. She has 3 grown children, 3 grandchildren, and 1 talkative Shih Tzu mix who aspires to be a therapy dog someday. Her passion is supporting and empowering individuals and families along their healing journey, and she has worked in domestic violence shelters with children with high behavioral and health needs, was on a crisis team for 2 different fire departments, provided medical social work for dialysis patients, and as a trauma therapist. And the common thread she's observed and encountered in her work is the prevalence of trauma, irrespective of one's gender, race, age, sexual orientation, relationship status, socioeconomic status, level of education, or geographical location. Thank you so much for joining us, Elizabeth. Can you tell us a bit about our topic for today?
Yeah, thank you, Caroline. And Chris and Sheila, I appreciate you having me here to talk about the topic that I brought for today. And I titled it, "You Are Not What Happened to You." And so I picked this, being a trauma therapist, to be able to start the conversation about trauma. And I think there's a lot of misnomers out there and information that can get convoluted, or just a lot of jargon in our profession, and it can be confusing for individuals. So I wanted to be able to bring this information in a relatable way to be able to help people move past surviving, because a lot of times we talk about when you're experiencing a trauma that you're a victim, and we talk about we want to survive that. But my personal belief is that I want to get people out of surviving and into thriving in their lives. And so how do we do that? And so today we're going to be talking about what trauma is, like what I see in my practice, some common questions that I hear out and about in the community and with people I interact with, or just with my clients themselves. And so we're going to be talking about what that looks like, what a trauma is, and then looking at what can we do to help ourselves and those that we love to work through this process. So just starting with trauma, what is it? And there's so many definitions out there of what it is. And I like Dr. Bruce Perry's definition of trauma, that he's a child psychiatrist who works with traumatized children. And so he believes trauma is an experience or pattern of experiences that impairs the proper functioning of the person's stress response system, making it more reactive or sensitive. So instead of making it out to be just one experience or something that you would encounter maybe one time, it can also be a pattern. And it's that physiological change in your body that is what dictates what trauma is, what could be what could be trauma. So some of those things could be physical, sexual, or psychological abuse or neglect, including human trafficking. It can be natural disasters or technological disasters or terrorism. It can be family or community violence. So we've seen a lot of community violence in the last few years with all these mass shootings. That can be traumatic. A sudden or violent loss of a loved one. Any exposure to substance use disorder. So whether it's through your own personal disorder or somebody in your family. Refugee and war experiences. So we see the Ukrainian war and seeing the refugees coming out of that. So I know there's a population, we kind of talked about that in staffing this week there from the Afghanistan war that settled into that Boise area. Severe accidents, car accidents, different types of accidents, falls around the house that create serious injuries, life-threatening illnesses. So if you're exposed to something that is a threat to your life, military-related stressors like being deployed for the military, having a parent leave or a sibling, that can be a traumatic experience for some, losing a parent through a military action. But also one last one that's not really talked about is that environments permeated with chaos. So those that have inconsistent parenting practices or marginalized households. So populations that come from poverty or where they are at a deficit for being able to operate at the capacity of the community. Those environments actually create those same effects of trauma. So that's why I believe it's so important, because when you look at all of those, that long list of what can be considered traumatic, pretty much either you've personally experienced something like that or you know somebody that's personally experienced that. And SAMHSA came out in 2019, and that's one of the government agencies that deals with substance abuse and mental health disorders. They have a statistics from 2019 that 2/3 of children before the age of 16 will report at least one traumatic event in their life. And so I believe that's why it's a conversation we should be having.
So with you, Liz, and you've had a lot of different experiences throughout your life with different careers, and what's bringing you to the table about this topic with trauma?
So what's bringing me is that coming to an understanding about that when trauma happens, it changes our brain. And so when we understand that our brain is being activated and that stress response system is being activated, it's going to impair the way that you show up in the world. And so knowing that, and knowing that this thing's either happened to you or somebody that you know, that can help you to work through that process, to have compassion and understanding, and also to provide community and support, because one of the most powerful ways of healing is through community. And so so knowing that is my passion, to be able to bring that knowledge to people, that if they can understand that they're not what happened to them, that it's a brain change, but they do have the capacity and power to do the work to change that they'll be able to work through and heal those traumatic experiences, to improve their relationships, improve their mental health, improve their physical health, and just give them that, what they want to have in their life. What's their purpose? What's their passion? Being able to connect to that.
You kind of talked a little bit about like how trauma physically changes your brain. Could you talk a little bit more about that and like what it does and what are some of the like long-term effects of that happening?
Yeah. So when you have a traumatic experience, it's going to activate that stress response system. And that's just a natural process that the body has that involves many different parts, but it's basically a way for your body to go into motion to be able to help you survive whatever's happening at that moment. And so when that happens, you're acting out of the amygdala, which is that base brain, we call it, like the amphibian brain, some people call it the ancient brain. There's all different, connotations or metaphors for it. But basically it's that fight or flight that response, being able to help you in that moment. And what happens is based on all different kinds of factors, but primarily who is there with you in it and after it will determine how well you are able to interpret that and process it. Because when we're operating in that amygdala, we don't have access to our prefrontal cortex, which is our executive functioning, where we have that higher level thinking and reasoning and being able to understand, what's really truly going on in that moment. And
Some
so
people are reactive in that moment oftentimes. And so when you're saying the people who are around the person who's in being abused or traumatized, based on the interaction they have with whoever that is around, has a prolonged or maybe a superficial impact, but potentially a prolonged impact too. Is that correct?
correct, yeah. And so what's happening is the brain's constantly monitoring the environment, engaging whether or not we belong there and whether there's any threats in there. So how you respond is you might get reactive and act out, or you might shut down and go into that freeze mode of where you dissociate almost, to where you're not able to interact with those around you. And when it's going to take an amount of time for that stress response system to calm down, to calm those systems down and come back to that equilibrium state to be able to return to normal level of functioning. So if you're constantly having that system activated, then the less likely you're able to handle even small amounts of stress, because you're already so heightened internally. You might not see it on the outside, but internally you're able to measure that by different factors: heart rate, blood pressure, things like that.
Right. And so sometimes with people, if they're in a traumatic accident or something, and there is EMTs who show up, and there's help that happens right away, the trauma effect is not as profound in that for that individual. But if there is a child who's in a situation that there is no protection, there is no help, and they have to really do it on their own, essentially, and whatever the moment may be, or an adult in a similar type of complication or situation, what is the difference between someone who is having outside help immediately that helps them to feel safe versus a situation where a person is in whatever their age and they're not necessarily getting the help immediately and they're having to do it on their own?
Well, the difference is when you have that help and you have that kind, loving support, then that helps. That goes back to your experiences in early childhood of where you had that attachment to your parents. And if your parents showed up for you as loving and kind, then that's what's familiar to your brain. So that's going to feel safe. It's going to help calm down that threat response. So you're able to calm down and then be able to reason through it. But if you were not exposed to kind, loving attachments early on in childhood, or maybe you were, but in those first, few months to year or two, you weren't, that can greatly increase your capacity or ability to receive that support, receive that help, because your brain is going to be wired differently. Your brain's wired based on those early experiences. And so even somebody has an accident and has an EMT that shows up right away, if they have, depending on what their life has been up to that point, they may or may not be able to respond well to that accident. And so there's a lot of studies out about how individuals with childhood trauma history actually have longer, more chronic disabilities and injuries from some of these adult accidents that might not be what we would consider traumatic or serious.
So
Mhm.
with children who have or people who have maybe insecure attachments during childhood, or have maybe other traumas that happened during childhood, and they don't really believe inside of themselves that they have a value, or don't know what to do with themselves and internally, have more complexity with trauma than do people who feel more of a security inside of self based on a belief. Is that correct? So that belief within inside of self is really a key to how people deal with complexities and traumas. Can you talk about that for a second?
Yeah. And that's what we believe about ourselves matters. It's those early experiences in relationship to others that helps develop our beliefs about ourselves, about other people, and about the world around us. Is it a safe, loving, kind world, or is it a scary, lonely world? And so based on those beliefs, that's how you're going to live out your life. It's our beliefs that create our experience. And so if you're believing that you're a victim of circumstance, or you're a victim of all these things happening to you, you're going to go through life expecting that you just have to go with what's happening to you, and struggling to achieve simple things, and not being able to get to that place of what you would like for yourself or would want for yourself. But if you are able to change that belief, and actually those belief systems can become what is familiar to you. So when I talked about that, the threat response system gets activated when we're exposed to things that are unfamiliar. Now, not everything that's unfamiliar is a threat. It just might feel like it to our bodies at first. And that's why there's those predictable, reliable, healthy stressors that help challenge us and grow us. But when it's these things that are unpredictable, inconsistent, chaotic, those unfamiliar things are the things that give us those traumatic, long-term chronic things of physical health issues and mental health issues. So those belief systems become familiar to you. And so when you challenge it with something, when something comes at you and it's different and it challenges that belief, our automatic, default response is, that's not true, that's not safe, even if your belief is creating your own distress.
Right. And that's why I think there's a lot of belief work that's done in therapy, is to help people to modify their belief about themselves. But that's hard when you're living in an environment as a child and you've been indoctrinated to believe that the world is unsafe. And so sometimes that's really, really hard to change that up in therapy. That's where the course of therapy that can change over time. But it gets back to this idea of what happened to me as a child. It's going to impact me the rest of my life, and how to be able to encourage people to come to facing their fears and understanding that they can get into help and get into therapy to talk about that. Can you discuss that a little bit more about that process, or the idea about facing their fear and changing belief?
Yeah. So like I was saying, that when we're hit with those unfamiliar experiences, it will create that stress response activation, because it's something that we're not used to. And so oftentimes, though, based on those childhood experiences or even adult experiences where you're exposed to something traumatic, and you have this belief that the world's not safe, so it feels almost like as if you're going to die. like in a way, that's how your body's responding. It's that survival mechanism. And so what we try to do in therapy, or even just in healthy supportive relationships, is changing that narrative, changing that understanding of, when I do this, that I am able to receive love and support and encouragement. And it doesn't have to mean that I'm going to die. It doesn't mean that something horrible is going to happen. And so it's just creating that consistent, reliable, predictable interaction and experience from a place of kindness and nurturing that's going to shift the belief in where they're able to start to feel safe in those new beliefs. But it all comes down to the personal choice. And if you're going to recognize that this is just my body having a physiological response to this, yet I'm still safe. And so if you can understand that, and you can understand, oh, my heart's racing, but I can calm it down. My body feels like I just need to run away. I can just do something to calm it down, and I'm going to be okay. I'm going to be safe.
Mm-hmm. Could you talk about some strategies that people could use to help calm themselves down if they're like feeling like that and they're like feeling like they're, on the edge of a cliff?
Yeah. So I like to use techniques that work quickly to be able to get you back grounded into your body, because when you're grounded in your body in the present moment, you're not in that cycle of anxiety of the past, or sadness about the past, or fear about the future, and you're able to just focus on what's right now. And so I like to work with clients on doing some muscle relaxation that we can do within 5 seconds. So I do a technique that's called wet noodle that I learned from Dr. Eric Gentry, who does a lot of trauma work. And that's just counting to 5. And as you count to 5, you imagine your body going limp like it's a wet spaghetti noodle. And so I work on that with clients together. We'll work on, when we get into that stress response, we go almost into this tunnel vision. And so we'll do a technique of peripheral vision, where I have them, you can focus on a point in front of you, directly in front of you, and without moving your eyes, as you slowly, count to 10 to 20 seconds, you start to expand your vision to try to see what's at 10 to 2 o'clock if you're looking at the clock. And so expanding that awareness is going to help shift that nervous system reaction. It's going to help calm it down. I do a technique called square breathing, which uses a combination of eye movement and breathing, because breathing, we know, is one of the greatest ways to help calm and create physiological change within your cells. But breathing oftentimes can take 2 to 5 minutes to really start to calm down your system. And that can be a long time for somebody who's in significant distress. And so the square breathing, I've found, works a lot quicker to get them, because it combines that eye movement where you're basically tracing a box with your eyes, where when you're going up on the one side, you're inhaling, and then as you go across, you hold your breath, and then as you go down the next side, you exhale, and then you're going across, you hold your breath. And so I'll just do that with my clients, and I'll practice, and I'll have them follow my hand across the screen. But if you're on your own and you don't have somebody standing in front of you, you can find any square object or rectangle object in front of you, or even just imagine one and start to do that, and using that. But there's other types of physiological, deactivation type of techniques that you can do to quickly calm yourself. Even just looking for 5 colored objects or 5 different shapes, and trying to look and get outside of that rumination or that intense sensation that's going on in your body.
So
Awesome,
you're
thank you.
shifting by doing those techniques, you're shifting yourself from an emotional state to a more cognitive state or rational state. And by changing states, by practicing those techniques and changing states, is you calm down your anxiety quicker, right? Anger quicker.
Yeah, you hopefully are able to stop that response from continuing to escalate, and then you're able to calm yourself and be able to have access to your reasoning. Because when that system gets activated, you really have limited to no ability to access that higher level functioning in the brain to even understand or look at it differently.
So when people have experienced a lot of trauma or difficulty or relationships that have not been very reliable or consistent for them, and they have other problems, maybe if they're a child, they have childhood issues, they get into elementary, junior high, high school, there's these situations that are unsafe that continue to compound this belief of that I can't do it. So I had something that maybe bad happened to me when I was a kid. I really don't want to come back and talk about it, because every time I think about it, I'm getting activated back in this situation. So I want to avoid it. I want to distract myself or avoid it. I want to, people aren't going to say that I want to use drugs or alcohol, but a lot of times they do, or they'll sexually act out or something like that to distract themselves so they don't have to be thinking about getting into stuff. And so people don't want to come into therapy because they know, go to therapy, what's the therapist going to ask? And then people are trying to avoid it. They don't want to deal with that. So can you talk about that for a minute?
Yeah. Well, and that's very common. I see that all the time. And the problem is that we can try to avoid it, but our brain is constantly on alert, trying to keep us safe and try to prevent us from feeling that same feeling again, because we thought we were going to die, or we thought something horrible and awful was going to happen to us. And so whether that can even be as simple as somebody giving you like the look, right? Or having a smell, or hearing a sound, and they get activated. And so we can try to prevent going into those same type of things, or try to prevent talking about it, but ultimately we're just prolonging our suffering, because until we are able to calm down our system, learn how to do that, and to get into safe, healthy relationships, and then be able to process what happened, we're not going to be able to calm down that stress response activation, and we're going to be constantly activated and not understand why.
So people who have been traumatized oftentimes are re-traumatized in situations because they're trying to avoid having to deal with the trauma. And sometimes they get more deeper into maybe complicated relationships or other situations because of that fight, flight, and freeze that you were talking about before. And so
Yes.
It's hard to kind of know when to regulate that, how to pull that back, how to set up the boundaries and where they go, and how to be able to assert oneself to do that. So that's another part of therapy. Is that correct?
Right. And two, I was going to say, I have a lot of people that I've worked with and clients that will say, I tried everything not to marry my dad, or not to marry my mom, or not to date my parent, and they're like, they come to this realization that they might not do the same things, but it feels the same way, and they don't understand that. And it's because it's that familiarity, that dysfunction feels safe, even though it's not. It feels safe. And so it's teaching them to understand, to get connected to their body, to understand what's going on, to recognize that you are being activated, that you are having, try to build your awareness, the capacity for your awareness to get in tune, to have that time to recognize something is off within me. I might not know what it is or what caused it, and that's okay. It's just being compassionate with yourself in that moment to know my stress response system's activated. How can I calm it down? And then later they can process what was going on at that time.
It seems like everything really goes back to, your childhood and how you were raised, familiar situations. Is there a way to like truly rewire your brain? And if you learn like unhealthy coping mechanisms as a child, to learn healthy ones?
Yeah, that's one of the greatest truths I think that's out there that people don't know or might not understand, is that you don't have to continue to live from that place. You don't have to continue to keep acting out that same behavior. You can change it. Our brains have this wonderful thing called neuroplasticity, that we're able to rewire those experiences through, I call them corrective experiences. It's through those safe, nurturing, reliable, consistent relationships that we can heal, and we can start to change our beliefs that the world is a safe place, that we do have the capacity to protect ourselves. We have the ability to do that. We have the ability to take care of the things that we need, and we can live the life we want to live. And it's all based on what we want to do and what we choose to do.
So people have a lot of hope, is what I hear you saying, and that you have capacity, techniques, and skills to be able to help people who are very afraid of coming into therapy, and to be able to help them to get to a better place.
Yes. And that's one of the things that just continues to astound me and surprise me. And just one of the wonderful things is that there is hope in that. Even things that you think are just too much, that you'll never get, you'll never be able to heal, you'll never be able to do different, you'll never be able to make a different choice, that you can work through that and come out on the other side of it and be thriving. You do have that capacity and ability. That it's just finding the people to show you that, and give you those opportunities to show yourself that.
So what type of intervention do you feel like works the best in your practice, to be able to help people who are really afraid, have been traumatized, have a lot of maybe addiction issues or complications in their lives? They don't really know what to do next. What are your suggestions? What do you do?
So I work on creating a safe, secure environment, being able to show compassion, non-judgment, being able to help them understand that everybody makes sense, that we don't do things in a vacuum, that we make choices and we live out our lives based on things that we just don't have an awareness of, and that it's okay, and that there is hope to do something different. And then I work on getting that stress response system calmed down, working on tools to help them get their body regulated. And then I find EMDR, which is eye movement desensitization reprocessing therapy. I find it is just profoundly effective, because it's a type of therapy that uses your brain's natural processes to reprocess those painful experiences and painful memories, to be able to shift those beliefs. So it's not just well, I hope to believe this someday, or I want to believe this. It actually shifts in your body where you will feel that belief. And that's when you feel that belief is when you can walk out that belief. And so that type of therapy is able to shift those belief systems. And we don't have to go into great detail, which is the other amazing thing, is that we can do the processing and you don't have to share all the intimate details if that's scary for you, if you don't want to. It's whatever your level of comfort is. And I'm here to just be like this vessel, this guide to help you along that process and that journey towards healing. And once, yeah. Oh,
Sorry,
I
I
was
didn't
saying,
mean to interrupt you. I was just going to ask if you could tell us a little bit more about EMDR and like how that process works.
yeah. So what I was just going to say, I'll tell about that too. I was just going to say that I find really, if somebody's coming in and they have these trauma histories or have things that are really activating that stress response system, they're not able to do any cognitive work because they're constantly just living from that survival place. So the EMDR can work to help calm that down and start to shift those beliefs to then we can do the cognitive work. So what EMDR does is it, the way I explain it is it takes these memories. So what happens is our brain is designed to process the everyday things that come in, all of the different sensory experiences and relational experiences that we have, and it processes them while we sleep and decides what's valuable information and what can we get rid of. And when we are exposed to something traumatic, a traumatic event, or that chronic stress that I talked about, that chaotic environment, the brain gets overwhelmed and it's not able to neatly package and put away what's happening. And so when that occurs, it gets stored maladaptively and creates those symptoms of anytime the brain's reminded of that experience is when it gets activated and we start to have anxiety, we can have flashbacks, we can have depression, you have the fear that we've talked about, all those things, and you could start to dissociate where you just start to check out, or you become reactive and you have different behaviors from that. So what EMDR does is it goes into those experiences, those belief systems that were created and wired, and it uses present safety, so the felt sense of being present in the moment and having access to that prefrontal cortex, so being safe, and it goes back in using eye movement, which is what the brain does at night when we're sleeping, to target those specific memories that are not packaged away correctly. And it's able to look at it with new awareness and reasoning, and able to look at it in a new way then. And so it will reduce the distress that's activated when you think about it. So it's not going to take away the sadness or grief of like the loss. Like if you lose somebody, or if you have something happen to you, that's a loss. It's not going to take away the sadness if you think about it, but what it's not going to do is it's going to prevent those memories from intruding into your present moment and creating distress for you. So it's going to calm that down, and then it's going to help you shift and rewire your brain to believe with that felt sense in your body of the new belief that you want to walk away with from that experience. That whether it's I'm okay now, I deserve love, I'm lovable, I'm good enough, whatever it is, you get to pick what that looks like for you.
And what kind of success are you having with that with your clients? Because you mostly see traumatic clients who have had trauma.
Yeah, I mean, I'm seeing huge success. Things that are shocking even to me sometimes is that can heal, and where uh, they're able to look at these scary events and be able to see it in a way that they recognize it wasn't their fault. If the situations where they were hurt by somebody else, it wasn't their fault. They didn't cause it. They didn't do anything to create that situation. And they're able to work through that and let go of that shame, get rid of that shame that's holding them down, weighing them down, and be able to walk away knowing I do deserve good things. I am a lovable person. I do have power to change things in my life if I want to. And so even clients that have dissociative symptoms are able to, and flashbacks, are able to process them and calm those down to where they no longer have them, where they no longer would meet criteria for PTSD, post-traumatic stress disorder, where those symptoms are resolved.
And are they resolved long term, or is this a brief thing and they all come back, or how does that work?
So I say it's a long term, because you are actually rewiring that memory. What can happen sometimes is, because we don't know all of the different sensory experiences of what's happening at that time, or we don't know all the beliefs necessarily, we do the best we can to come up with those, that sometimes that things later on can get activated because maybe we didn't completely finish out some memory. But for the most part, what I've observed and experienced is that it's resolved long term. We're able to get to all of the things that are connected, because I try to do a lot of work about making sure that we do a timeline of the past that are connected to those beliefs, things in the present, and then we'll even do some future processing, like just imagining what that would look like in the future, that belief in the future. Are they able to carry that in the future? And so if I have, the person work through that whole process, they're able to walk away, and it's a long-term effect. It's like they never believed anything different, because it's that felt sense in their body.
So do you find as people are working through the trauma and getting to that place, which people who have had trauma probably don't believe that that's possible, but as people find out that it is possible, do you find them finding themselves to be more free, to be innovative or creative in their lives, because they don't have the noose of the trauma or the hypervigilance of trying to prevent those things from happening? What do you see the outcomes are after people kind of go through the process and get to another side? Where do they go with it?
Yeah, so that's exactly what I see, that their brains are not burdened down by those hyper aroused states, by the constant activation. And so they're able to be more present in their life. They're able to show up, and they're not as exhausted. They're not drained all the time, because their body's not having to work all the time to bring it into equilibrium. So they have more energy. They're able to have peace. They're able to have joy, happiness, because they're not weighed down by these constant activations all the time. And then they are able to have creativity and use their imagination, because they're not having to exert so much energy to not remember.
And so there's a high level of recovery with people who've been traumatized, and EMDR is so effective with helping people with that. That's why I think it's a beautiful thing, and it's relatively new therapy over the course of probably the past 10 or 12 years or so. Is that fair to say?
Well, Dr. Francine Shapiro, who created it was in the 80s, but it's been around for a while, but I think it's becoming more widely known and practiced probably the last 15 years or so.
Yeah.
So yeah, but it is very highly effective, and it's I think it's a number of different factors, but I think it's that combination of calming down the threat response system, that and being able to rewire those beliefs to that felt sense that you can live out your life differently after you've done that.
Yeah. It's been shown to be such an effective tool, that people are able to reclaim their lives and start to do their life and have more freedom in their life. It's the outcomes that I see, which is, I think, is a tremendous hope that whatever the problems are that people have had in their life, is that you and therapy in general has solutions for those problems that people didn't think there was a solution for. They didn't believe that they were not aware that there was a solution for it.
Yes. Yep.
And
Yeah,
so I think that is a tremendous gift. The therapy offers a tremendous gift to people who come in for work and working on their traumas, and especially people who are suffering so much from the complexities of trauma and the pain and the agony of that. And I appreciate you coming on today talking about your expertise in this and what you can offer. What you can offer to be able to help people to get that hope, to be able to have that change, and to get to another place to be more innovative and creative in their life, as opposed to being stuck in the past or stuck in the traumas that have impeded in their ability to grow.
Yeah. Well, I thank you for giving me the opportunity, because I truly am passionate about it. And it's when I see the pit that people come to see me from and the healing that they have, it's such a privilege for me, and just an honor to be able to be on their healing journey and to see them get to that freedom, that they don't have to live that way anymore. And so the more people that know, that's what I wanted to talk about this. The more people that know, that have that awareness that it is possible, there is hope, that there's nothing that's too much. I've had clients that have had horrific childhood experiences from early on, that have had healing and freedom, and that there's no one that is beyond hope.
And on the flip side of that is that some people have not had major issues that have happened. And I think that EMDR is effective for all people who have had loss and difficulties in their life. Is that reasonable?
Yeah.
So it doesn't have to be a horrific thing.
No, and I've even been able to, it was developed as a trauma treatment for PTSD, but now, because of the study and the research and that they've done, and been able to have that evidence-based research around that, they know it's effective for all types of things. So not just trauma, it can be effective for anxiety and depression and obsessive compulsive disorders and substance abuse. And so, I encourage obviously based on who I'm seeing and what's going on with them, we try to incorporate some kind of EMDR into all the clients that I work with.
Yep. And you do a marvelous job.
Well, thank you.
So,
Thank you.
Caroline, do you have an additional thing you'd like to ask her?
Let me think. Not really, I guess, unless there's anything else you want to talk about, Elizabeth. Any last closing remarks?
I guess my last closing remark would be to never give up. If you're afraid to come into therapy and you start talking to somebody and you don't feel safe, that's okay. Like, we're all out here. I view as clinicians, as therapists, as all on the same team. And so if it doesn't work with me, we've got somebody else here that's maybe is going to be a better fit, because maybe I remind you of your mom or your sister, or, maybe you just don't like the way that my voice sounds, or who knows, but just never giving up, that there, and wherever you're at, that there's always hope, and that there's nothing that that we are going to try to make you do, that you are the one who gets to make those choices and be able to change your life.
I love it. Thank you so much for joining us today, Elizabeth. Everything was very well said. You did a great job.
Thank you.
And thank you for joining us on the Navigating Your Mind podcast. If you want to learn more information or set up an appointment with any of our therapists, please visit our website at eastidahotherapy.com. Enjoy the rest of your day, and we wish you a life of peace, joy, and happiness.